Today marks 4 years since the World Health Organization declared COVID-19 a global pandemic. Since then, millions have died and even more have been infected and hospitalized, making it the biggest health crisis in a century. Right now, I am joined by Dr. Steve Evans, the Chief Medical Officer for MedStar Health. Dr. Evans also led MedStar's response to COVID-19. Thank you so much for joining us tonight.
My pleasure. Nice to see you.
Dr. Evans, it is really hard to believe it's been 4 years. I think we all know where we were, what we were thinking when life seemed to shut down, schools shut down, businesses had to change their way of life. Take me back to the moment 4 years ago, because you were treating some of the first patients.
So on March 5th, 2020, we admitted our first patient to MedStar Georgetown University Hospital. And I remember it very distinctively because it took 2 days to get the results back on the COVID test. We actually had to send the results, the actual specimens themselves, to DC Health. So 48 hours, now it takes 4 or 5 minutes to get the results. And at that time, we thought it would be big. We just didn't realize how big it would be. And then all of a sudden it exploded. And we had the advantage, I think, knowing that New York City was about 2 weeks ahead of us in terms of the pandemic itself. And so we had somewhat of a luxury of understanding what was going on in New York City was going to happen in Washington, D.C.
Right. I have spoken to a number of emergency room physicians and people who really, like yourself, have been on the front lines of this, the heroes of all of this pandemic. Tell me how much this pandemic has taken a toll on our healthcare industry.
Yeah, I think part of the big challenge, it's the right question. If you look at our nurses, respiratory therapists, and physicians during this pandemic, it's really difficult to take care of patients when you don't understand the underlying disease. And so part of the challenge is our nurses and doctors taking care of our patients in the intensive care unit, supporting their hearts and their lungs, and everything looks perfect, and all of a sudden the patient dies. And you don't understand why. And so the underlying diseases, we didn't understand COVID-19 and the challenges associated with it, knowing that blood clots could easily go to the lungs and kill these patients, or understanding the downstream effects and impacts of the disease. And so understanding how to diagnose it, how to treat it, we were in its infancy when it rolled out. And so it was very challenging.
Yeah,
the second part of this was that, as you recall, we tried to protect patients and families. So we restricted visitors coming into the hospitals for all the right reasons. But because of that, our nurses and doctors had to actually be surrogate family members for critically ill patients. And that's just an emotional burden that is really, really difficult. Yeah. And so that took its toll. And so you saw an exit of a tremendous amount of nursing leaving acute care medicine, leaving hospitals and going into different parts of medicine. And that's still a hangover from the pandemic and all the hospitals and healthcare systems around the country. We're still paying a toll for that.
Yeah, no doubt. We have come a long way in 4 years, but we are not clear of this. There is still COVID being passed around. Where are we with this pandemic right now? And how has medicine and how we approach global pandemics changed because of this?
Yeah, so the great news with a virus like COVID-19 is that it goes through these iterations. And so we saw the different strains evolve over the last 3 to 4 years. And each strain would be a little less severe, a little less virulent, but increase its transmission rates. And so because of that, the mortality rates are much less, but it transmits easier. So could you say it's morphing into something that looks a little bit more like a simple flu virus? And the answer to that is an emphatic yes. Do people, especially who are vulnerable, do they still die from this disease? They do. So if you just look at the flu on an annual basis in the United States, about 10,000 people die from that. And so we're going to see an impact on individuals who are vulnerable, predominantly in the elderly, but those who are older, who are immunocompromised. So all of the conventional things that we would do, staying masked, hand washing, all the things that we would normally do to prevent against flu become really, really important with COVID-19. So it's not going to go away. It's going to get rolled into influenza A, influenza B, COVID-19. And our ability to diagnose it is much easier. And our understanding of the disease is just so much better now. And the ability to treat it is just so much better now than it was before.
And you kind of mentioned it, but should people still be cautious? Should people still be getting the vaccines and doing their due diligence here?
I think if you're young and healthy, do you need to be vaccinated? At this point, and the answer to that is no. But if you are elderly, if you're over the age of 65, 70, 75, and you're on immunosuppression, and you have malignancy, and you have other associated medical conditions, heart or lung disease, then the vaccine is a good idea, and the CDC recommends that. So in the vulnerable states, it's really important. Also recognizing that masks are still a really good way to prevent transmission. And so if you're at risk in big groups, especially during this prime season where we are right now, and again, COVID numbers are not very high, but if you're in a big group, just like if you're at risk for developing influenza in around a crowd of 40 or 50, masking is a really good idea.
A lot of changes and a lot of work still left to be done. Dr. Evans, we thank you so much for joining us and giving that reflection 4 years later. We thank you for your expertise.